All right, let's get started. Marijuana 101. So we're going to start kind of with a broad view here of what is marijuana? What does it do? For thousands of years, cannabis has been used for spiritual, medicinal, and recreational purposes. There are a variety of reasons someone may choose to use marijuana. Different marijuana strains have variations of the cannabis plant that may elicit different psychological responses in the same person. And there's many different things that can contribute to how marijuana makes someone feel. And this can be from time to time, even within the same individual, including their body chemistry, the amount of marijuana they've consumed, and the method they've used to consume, as well as the set and setting. And so set and setting are principles of where are you consuming and what is your mindset. So if you've had a bad day at work and you are consuming somewhere maybe you don't feel safe, you'll have a worse experience because of your mindset and because of where you are consuming. Right. How is marijuana consumed? So there's a few different methods of consumption. The first is the classic smoking. So inhaling the smoke of marijuana through a glass pipe or paper, but really it involves just burning the marijuana and inhaling the smoke. Then there's vaping, inhaling heated extracts, marijuana extracts using a vaporizing device. This is very similar to nicotine, but we're using marijuana extracts when vaping is occurring. And dabbing is when you have concentrated doses of marijuana extract that are heated and then inhaled, which can be a little bit more intense than vaping. And then there are edibles where you're ingesting marijuana either through a baked good or perhaps a tincture that's put into gummies that you eat. And then the onset can be 15 minutes to a few hours, where the other methods, the dabbing, vaping, and smoking, the onset is almost immediate to within the first 5 to 10 minutes. Edibles are also an area of concern for children because the marketing can be very similar to candy that they're familiar with and other sweet treats. They might not even taste like marijuana either. So they may eat them, not realizing that there's marijuana in them, causing issues down the road. And then we also have topicals, which are like lotions or creams or salves that have CBD in them or some other kind of marijuana extract, and they are administered through the skin. So it's just applied directly to the skin. And these ways of consuming are typically not psychoactive. They are more for muscle relaxation or just general body aches and pains. Okay, information for parents. And this is great information if you are a parent or if you work with parents, if you have, if you work with kids, it's really just great information in general. It's important for parents to know the facts about marijuana so that they can have open and informed conversations with their kids. There's a lot of myths and a lot of misinformation about marijuana, so making sure that you have the right information and doing fact checking and doing some research before you have these kind of conversations with kids can be really helpful. Talking about marijuana or other drugs may not be easy or fun, but it's important to remember that you're not alone in these conversations. With marijuana being legalized recreationally, kids may be hearing about this sooner. They may be talking about it with their friends, seeing it on TV, driving by a dispensary, and they'll have questions. So know that you're not alone, that other parents are struggling with the same thing, and they are also trying to figure out how to have these conversations. But really, the goal is to have open communication. And the goal of that communication is to encourage thoughtful conversation between you and your child. So keeping it non-judgmental, keeping it open, letting them ask questions. And I have some tips listed here for effective communication. Be a good listener. Listen to the questions that they have, the experiences that they've already had. Maybe they don't have any experience yet, but really trying to understand where they're at and what you can do to support them best in making a healthy and safe decision. Another tip is to acknowledge their point of view and be open to sharing your own. They may have had different experiences than you. Things are a lot different than when a lot of us were kids. And so listening to what they are being exposed to and what they are experiencing can be really helpful in navigating that conversation. And using open-ended questions to encourage reflection. So the best way to keep kids safe is to give them the tools so that they can make their own decisions, make informed decisions. And so guiding them towards making the right decision will be more effective than just telling them what to do. So making sure that they have those tools and knowledge to think critically about what marijuana does to their bodies and what that means for them in the future. And if you are a parent that uses marijuana, the best practice is to lock all marijuana products away. So locking marijuana in a lockbox or a locked bag can prevent children, adolescents, or pets from accidentally ingesting it, which can be quite common. If your child accidentally ingests marijuana, please call the Poison Control Hotline, which has an easy to remember phone number, and watch for the following signs, which are problems waking or sitting up, difficulty breathing, and sleepiness or drowsiness. It might not be easy to spot at first, but if you notice something's off, it's always a good practice to keep track of where your marijuana is and if it's locked up and if any is missing. And if your child is experiencing a medical emergency, please call 911 or take them to an emergency room if you are concerned. Information for teens. So when teens are making these decisions, there's a few things that they should consider when deciding if they're going to consume marijuana. The first one is learning and memory. Regular use as an adolescent may impact the ability to learn and retain information. Kids' brains are still developing. They really aren't fully developed until their mid-20s. That frontal cortex is the last part to really form. And so regular use when they're young, when the brain is still so pliable and learning so many new things, can impact their ability to learn and retain information in the moment, but also later in life. That can be irreversible in their brain to having that damage done as an adolescent. So if they're interested in, if they have concerns about learning and memory, please let them know that when their brains are fully developed, that is something that they can explore. And then we have physical performance. So if you have a teen who's very into sports or very into their exercise or physical activity, teaching them about how smoke inhalation can weaken the lungs, making it harder to participate in athletic activity. Marijuana can also affect coordination, hand-eye coordination and balance, as well as making learning new skills difficult. And we have extracurriculars. So if your kids are participating in after-school activities by breaking school policies, I don't know of a school that doesn't have a policy against marijuana use, but breaking school policies may get you kicked off of a sports team or suspended, expelled from school, which can have devastating consequences to your academic performance, but also your ability to participate in some of these other activities outside of school. And then work. Marijuana use is prohibited by many employers in Michigan and may affect your ability to get a job. A lot of them may drug test or have other policies against marijuana use, and we don't want that to prevent them from getting a job later in life or right now. And then we have legal woes. So a minor in possession is anyone under 21 just in possession of marijuana, which can come with a fine, community service, or possibly court-ordered drug treatment. And these can be quite a burden for a lot of kids. And so keeping that in mind, that there are legal consequences for even just the possession, but also consuming. Medical marijuana. Marijuana has been used as medicine in different parts of the world throughout time. This is nothing new to being a human, really. Marijuana has been used for a long time. There's scientific evidence that suggests the benefits of marijuana for a variety of medical diagnoses, as well as pain management. More research is needed to understand whether marijuana is a successful treatment option for mental health conditions such as anxiety or ADHD. As I mentioned, each experience can be different for someone every time that they consume marijuana. And there are certain circumstances where anxiety can be heightened or that paranoia can be heightened by marijuana, but for others, it may have more of a relaxing and calming effect, which can help them manage their anxiety. And same with ADHD, it may help them calm down and relax, be able to concentrate and focus, but it could also have an activating effect, which spins up their ADHD even more. And marijuana can impact mental health in certain circumstances, as this is dependent on chemistry and situation of each consumer. So like I said, each time that they use can have different effects, which is hard to regulate and use reliably as a source to deal with some of these psychological mental health disorders. And state laws vary in which conditions qualify because it's still federally illegal. States that have authorized medical marijuana are the regulatory authority for that. In Michigan, the most commonly cited condition is severe and chronic pain, but other less common reasons were cited, such as cancer-related pain and post-traumatic stress disorder. And here on this slide, I have a list of all of the qualifying conditions in Michigan. So we have cancer, glaucoma, HIV, AIDS, hepatitis C. There's quite a few chronic diseases on here, genetic diseases. There's also a condition here at the end that if you have a chronic or debilitating disease or medical condition that produces one or more of the following, like severe and chronic pain, severe nausea, seizures, severe and persistent muscle spasms, like multiple sclerosis, for example, is not on this list, but still could qualify if you are experiencing some of these other symptoms that you believe marijuana could help alleviate. And the process for obtaining a medical marijuana license involves talking to a doctor who is willing to prescribe it, as well as having that diagnosis of one of these qualifying conditions, and then paying a fee to obtain the license. Expectant mothers. So there's some evidence that indicates an association between prenatal marijuana use and lower offspring birth weight. There is a lot more research that needs to be done because that impact is not fully understood. Below, we have the American College of OBs and GYNs say that there are no approved indications or recommendations regarding prenatal marijuana use, particularly because the impact of prenatal marijuana is not yet fully understood. And so the way that we can understand this better is with more research and more time. But because marijuana is federally illegal, that makes a lot of research difficult. And there's a lot of hoops to jump through to do that kind of research, especially considering the ethical considerations. Okay. I see there's a question in the chat, and I will come back to that at the end once we get through some of this information. So we have a vast majority of Michigan expectant mothers did not use marijuana before, during, or after pregnancy. This is based on a study that was done by the Injury Center at the University of Michigan. Among mothers who quit using marijuana during pregnancy, the majority did not return to marijuana use following in the months following birth, and about 1 in 5 mothers with pre-pregnancy use resumed marijuana use after pregnancy. So just some interesting data there about Michigan. Marijuana and the law. Now, this section is a little bit longer just to make sure we cover some of these important things. It's like I mentioned, it's important to remember that while legal in certain states, it is still illegal at the federal level and is classified as a Schedule I controlled substance. In 2018, Michigan became the first Midwestern state to allow both medical and adult use marijuana use. So this is the recreational use. The Michigan Regulation and Taxation of Marijuana Act was passed by Michigan voters in 2018 and allows anyone 21 or older to possess up to 2.5 ounces of marijuana and to grow as many as 12 plants at home. It also sets up a system for taxation and regulation. So marijuana is subject to a 10% excise tax in addition to Michigan's 6% sales tax. And this law went into effect in December of 2018, and the first retailer opened to the public in December 2019. And it is up to the local municipalities how many dispensaries they allow within their municipality. Some of them may have set that limit at 0. Some of them have no limit, or maybe 2. But approximately 3/4 of Michigan municipalities have banned adult use marijuana retailers. They are still out there. Okay, so just a few things about what is permitted under the law and what is not permitted. What is permitted under the law is anyone aged 21 or older may possess and consume marijuana. And where marijuana sales are legal, an individual can purchase up to 2.5 ounces. However, an individual cannot have more than 15 grams of marijuana concentrate at one time. So this is preventing people from keeping a large amount on hand in their homes and trying to prevent that distribution and illegal trade of marijuana. At home, an individual may keep up to 10 ounces of marijuana flower in a secured location. So this may be a safe, a locked box, a locked closet, anything like that. And under Michigan law, the following is not permitted. So public consumption is not permitted. This is where it differs from alcohol a little bit. So public consumption is not permitted. There are no public venues where you can smoke outdoors. Driving under the influence of marijuana is not permitted. There are a lot of health promotion campaigns and prevention campaigns trying to encourage folks to not drive while they're high and to not use marijuana while they're going to be driving or while they're actively driving. And individuals cannot cross state lines with marijuana because it is still illegal on the federal level. It is illegal to carry it with you across state lines, even if you're going from one state to another state where they're both recreationally legal. You have to buy marijuana in that state where you are at the time. And it's also illegal to bring on an airplane because the TSA is federally regulated. Okay, and so we have some local data here from our Eaton County BRFS, which is the Behavior Risk Factor Survey. And this data is from 2020 through 2022. So for Eaton County, at the time of the survey, 12.8% of residents reported using marijuana in the past 30 days. 14.2% of males reported using marijuana versus 11.9% of females. So a little bit more, we have more male use than female use. 1 in 4 of 18 to 34-year-olds reported using marijuana in the past 30 days. And as age categories increase, the percent of adults reporting using marijuana in the past 30 days decreases. So as we get into those 40s and 50s and older age groups, they're not using marijuana as much as the 18 to 34-year-old group is. And residents with a household income of less than $24,999 are more likely to have used marijuana in the past 30 days than household income categories with 25,000 and greater. We also have this pie chart right here shows the reasons people cite for using marijuana. So we have 66% of people report using it for recreational purposes, where 26% using it for both medicinal and recreational purpose, and then 8% using it for only medicinal purposes. All right, I'm going to go back to our question that we had. I know that was a lot of information. Okay, so minors seeking medical attention or counseling, there are similarly to other illicit drug use, there are laws in place that protect people from seeking out medical treatment, or if you bring someone into a hospital for medical treatment and you're afraid of the repercussions, the hospital staff will not call the police about it. They'd rather you're protected by that law, I believe it's Good Samaritan, but I don't want to overspeak here, but you are protected by seeking out medical attention. And in the same regard, parents who have unknowingly or knowingly ingested, similarly, understandably, there would be a fear of CPS and legal involvement. If CPS does get involved, they obviously do an investigation, and some of that would be found out. And in a similar sense, if you brought your child in because of an accidental ingestion, they would rather see that you're doing the best you can to protect your child than try to hide it or cover it up. I'm hoping that answers your question about the legality of it. And if anyone else has any other questions, feel free to put them in the chat. Unmute yourself. I can go back to a slide if you have a specific question. This is absolutely open to a back and forth. We do have in Eaton County last weekend, we hosted a lock bag giveaway. We were able to give away over 60 lock bags to our community to hopefully help those folks who are using marijuana either for recreational or medicinal purposes to keep it locked up away from their kids and their pets. We also were able to give away family first aid kits and Narcan kits, as well as some other harm reduction materials. And we do have those materials available at our health department location in Charlotte in Eaton County, and that's at 1033 Healthcare Drive. You just come into the main door. To the right, there is a vending machine that has a lot of our materials in it. And then we will also have some things available in our clinic area shortly. All right, if no one has any other questions, this went a lot faster than I thought it would. We are going to post these slides and the recording on our Facebook page as well as our YouTube page if you would like to watch it again, or if you have a coworker you think or a community member you think might benefit from this information. This will be available to the public. And again, I thank all of you for coming today and listening and keeping an open mind about marijuana and how we can best keep our community safe with it. So thank you.